Arm 5 was presented today by Fabrice Barlesi, and we did demonstrate that although we did not have a large number of patients, there was reasonably good control and activity against leptomeningeal disease in the brain. And commonly, this is a very common finding that we are seeing more and more as patients live longer. They're developing leptomeningeal disease, and previously there was no good treatments for this. And the fact that this was able to control and have responses in this setting was actually quite substantial. It's clear that this is the first documented trial that sets the standard for targeted agents and measurement of their activity and response in the brain. So I think this sets across the whole field of development of targeted agents as to how we can best measure the efficacy in the brain. So I think this sets the standard. In terms of improving patient care, we may consider that instead of radiating patients up front with a driver mutation, it may be better with active brain metastases or those with asymptomatic disease that are not substantially symptomatic to give them targeted therapy up front with the most active agents and control their disease and improve their quality of life in that manner. So I think we're learning more and more about disease in the brain, and this does set the standard for further study and trial development of other agents across the board.